Welcome back. It is 7:42. Chilly weather, strong winds, germs traveling around the office, and winter and spring are a time when many people are dealing with symptoms of allergies and colds. But sometimes the runny nose and coughing are a sign of other conditions. Dr. Zadeh, he's an expert and head and neck surgeon in the Los Angeles area. He's here to tell us about when a bad cold might actually be a sinus infection. So Dr. Zadeh, thank you so much for joining us.
Good morning. Thank you for having me.
That's a big thing because I just went through this myself.
Okay.
When do we know if it's a cold or just allergies or an infection?
It's a good question. It's actually sometimes difficult for us to tell also. In the first few days, it's very challenging to distinguish between a cold, an allergy, or a sinus infection. But basically, just to start, the sinuses are air-filled cavities that are inside our heads, in our skull. And they drain by little holes into the nasal cavity and they're lined by a mucosa. So if you inhale an allergen, this mucosa, this lining of the nose, gets swollen and cause a lot of congestion, a runny nose, itchy eyes, and sneezing, and that's a typical allergy, and it usually lasts a day or two if you're in that environment. It can last longer if you keep getting exposed. A cold is when you get the muscle aches and you feel sick and get the fever and maybe some chills, and that can be a viral process that lasts about a week. If these symptoms last more than 7 to 8 to 9 days, that's when you start thinking about sinusitis, because sometimes these cavities that are air-filled, it swell up, and the swellings close this little hole that drains into the nose, and as a result you get this closed space that now fills up with fluid and causes sinus pressure, and it's a perfect environment for bacteria to grow, and that's when you really have to go on antibiotics, because if you don't, sometimes this can last for months if not years.
Absolutely. So at what point, because the thing I'm always wondering is at what point do I go to the doctor?
That's a great question. So in general, when you have a cold, it's always wise to just have some supportive care, take some over-the-counter medicines, and wait for the first 5 to 7 days. Realistically, a typical cold gets better between 5 to 7 days. Obviously, if there's signs, such as you're having a tremendous cold, shortness of breath, or just bad pain or discomfort, seek attention earlier. But in general, it's wise to wait about a week. But after a week, if you haven't turned the corner, that's about the right time to really consult a physician to make sure there's nothing else going on.
And you said one of those things that could be going on, sinusitis. What are some of the complications associated with that, and how bad can that get?
That's a great question. So sinusitis in general can resolve by itself, or oftentimes with a short course of antibiotics can improve. But sometimes if these sinuses that are filled with air fill up with fluid instead, and the hole that drains them is blocked, they can fester there for a long time. Now, if you imagine these sinuses sit in very sensitive areas. They surround the eyes and they live right next to the brain, and they're separated by a brain by a very thin membrane of bone. So as a result, in very rare cases, if they're not controlled appropriately, especially in little children, they can actually spread to the eye and cause eye damage. In a worst case situation, you can lose vision. In most cases, just get some eye pressure. But in severe cases, which is again very rare, I don't want to alarm your audience, but if it's very rare, it can actually spread to the brain and cause a brain infection or potentially death. These are not common things we see. Most commonly, a sinus infection resolves with antibiotics after about a week or two.
Is there ever a concern about over-prescribing antibiotics and just letting the condition play out?
Absolutely. That's one of my passions, to be honest with you. Over-prescription antibiotic is devastating to our communities, devastating to actually the role of pharmaceuticals and medicine. So a lot of times it's critical not to jump to antibiotics, especially in the first 10 days perhaps. A lot of times these get better by themselves. If a sinus infection is persistent, or if you try a course of antibiotics and it doesn't work, then the best thing to do is to see a specialist, do a culture, meaning do a little swab with a Q-tip that's really simple of the mucus or pus that's draining from the sinus, and grow that for a couple of days on a petri dish and see what the bacteria is. A lot of times you'll be surprised, it's not even a bacteria, it's a virus, in which case you can just leave it alone. But if it's a bacteria, then you can see what antibiotic is a perfect antibiotic to treat that bacteria, and it's the least invasive antibiotics, so you don't expose people to unnecessary antibiotics.
And you said you obviously didn't want to concern our viewers too much, but in some cases, even surgery is necessary with sinusitis, correct?
It is. That's actually what I specialize in. So in some cases where patients undergo numerous rounds of antibiotics that are appropriate, or they just have an infection that lasts more than 6 months or a year, which happens very commonly, unfortunately, these patients have a chronic blockage of the sinuses. So it now becomes more of a plumbing problem in addition to the infection process. And as a result, we do surgery to drain the sinuses, to open up the natural holes that have been scarred closed because of polyps or because of chronic infection.
Any good preventative measures that we could be taking like ahead of time so we don't develop these symptoms, these infections?
Great question. The truth is, as with everything else in medicine, there's 3 things you can do. general body health, so exercise, a good diet, and a good mental health. Those are the three important things in anything in medicine. But with the nose specifically, taking care of your nose is important. So basically, obviously, avoiding smoking, being in smoking environments, avoiding pollution, which you guys in Santa Barbara are very lucky you don't have much of. We have a lot of that in LA. But also, there's something called a neti pot, which is basically saline. Any salt water rinse of your nose, if it's used appropriately, in certain patients who do have a lot of nasal congestion, allergies, and infections, they can actually clear the nose in two ways: by mechanically washing the mucosa of the nose, but also, in addition, it can actually rejuvenate the cells of the nose sometimes, allowing for better health for the nose.
All right, great advice, Dr. Zadeh. I want to thank you so much for coming on our show this morning. Dr. Zadeh, ladies and gentlemen, and we're going to take a quick break.